for life. We want to thank you for the blessings that you have bestowed upon us. We come here because we have a need, and that need is for us to learn more at your feet and be settled. As we are approaching the Sunday law, it's important that we understand this message and we internalize it, and then we'll be able to teach it to others. So may the presence of your Holy Spirit be with us this morning. In Christ's name we pray. Amen. Good morning to everyone. I hope you are all well. It's been a while since I've presented at this platform. I hope that I will not cause anyone to stumble, but that this morning we will be even more established in the message. So Tato, I don't know if you can allow me to share my screen.
Yeah, the host now.
Thank you. Okay, so today, the subject I'm trying to tackle, I just want to invite everyone to participate. It's kind of a broad subject. I'm not even sure if we'll be able to get through the material today. We'll try to see how far we can go with the study. It's kind of history. But we're going to be looking at the NHI. And before we even start with that, I want to hear from you what your understanding of the NHI is. The NHI is the National Health Insurance. Anyone with any thoughts? Have we all heard about the NHI? Because in order for us to truly be in sync with this message, we need to be in touch with external events, right? And in South Africa, there is something called the NHI. Has anyone ever heard of it?
Heidi.
I'm not sure. Two people spoke. Okay, Lindelo, you wanted to say something?
Yes, I want to try. NHI. I think it's whereby everyone in South Africa have a right to have an access in the healthcare service, like private hospitals.
Okay. Thank you. Tato?
Oh, yes. So the NHI is the National Health Insurance, and it is a system in which your healthcare will be financed by the government so that you can get uh, a good healthcare, you know. So yeah, that's that's the basic understanding of it.
Thank
Yeah.
you. Anyone else? And what are our thoughts about NHI? Those who, of course, have know what NHI is, you also should know that there is debates going on about it. And by and large, a good sector of the population are not very happy about it. So, as you're sharing what you know about it, what are your thoughts? It's a good thing, it's a bad thing.
Hello.
Yes, Milton.
I haven't got the details from the bill itself, but from the arguments people are posing, it seems like there's some elements which, when you look at it from the private healthcare perspective, it might affect them. At the same time, also the NHI bill is not going to entirely cover like a lot of expensive medical care that people with, let's say, chronic might expect. So at the same time, there might still be need of private healthcare, which maybe the limits and how far this will cover and not, it's still being understood, if I'm not mistaken.
Okay, thank you. So 50-50.
Yes. Already.
Yes, Tato.
So my thought is that the NHI is good because it goes in line with the universal access of healthcare and to get like a quality, obviously, healthcare. But obviously, there are challenges around it. However, when it comes to, uh, I know what's there, it's the funding and also, the public hospital infrastructures, improving that as well. So there's arguments also around that people are saying that why go for NHI instead of improving the the public hospitals that we already have and things like that. So it's those issues, but besides all these issues, everyone deserves the universal access to healthcare, especially quality healthcare. So in that term or in that light, I think NHI is a good implementation by the government.
Thank you, Tato. Thank you for that contribution. Any other thoughts? So far, what I'm making out is that, yeah, there are sentiments that is a good thing. There are sentiments that, oh, we're not so sure. There are sentiments that it's an outright bad thing. Anyone else wants to share their thoughts before we continue? Okay. Going once. Okay, I'm going to paint a scenario for us and tell me what you think about it. In South Africa, about 8% of the GDP is spent on healthcare. What does that mean? Let me share my screen so I can show you what I mean, what that means. Please, somebody let me know if my screen is visible.
Yes, yes.
Thank you. So a country's GDP GDP stands for gross domestic product. It is how much money a country makes every year in simple terms. I'm not an economist to put it in a better way. It's how much money a country makes or spends. If there's somebody that can explain it better, please. You're welcome to interject. It's the total money value of all the goods and services within a country's border in a specific period of time. So usually a year. So we'll say it's how much is being produced and including the services that are being provided in the country. South Africa's GDP is 405.3 billion. That was in 2022. Just to give a perspective, the GDP for USA in 2022 was 25 trillion. So in comparisons, if you compare our GDP in SA is less than 1% that of the United States. So about 8% of these 405 billion rand, sorry, that's in dollars, $405 billion GDP for South Africa, 8% of that is spent on health. So that's quite a significant, so almost 10% of the country's money is being spent in healthcare. Now, that 8% of the GDP, it's divided into half. 50% is spent in public and 50% is spent in the private care. So between the public and the private care, they are sharing 50% of that 8% of the GDP, 50-50. So the public sector is spending that 50% to take care of 83% of the population. Whereas in the private sector, they are spending that 50% on just 17% of the population. Can I hear any comments on this statement? It's in bold. I am highlighting it now so that everyone can read it for themselves and tell me what you think about it.
No.
Yes?
I think it shows that there is no equality in terms of the ultimate goal of how that money is spent. Because obviously 17% it's the group of people that are the minority which have access to funds, whereas the 83% is the vulnerable and they still get half of the share, which in terms of equity, I think the disparity is so huge.
The disparity is shocking, and it's crazy that when the president signed the NHI into law in May, and I mean, I think this idea of the NHI, we're going to look at the history of healthcare in South Africa. Actually, that is the purpose of these two lessons I'm going to have with us. Hopefully, we'll get through the material so that we can get a good sense of how things work in the healthcare. And so many people have been fighting against the NHI. Some are for it, some are not. And yet, when you look at the figures, really, 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 is this the kind of situation that we should be having in South Africa? That 50% of expenditure in healthcare has to take care of 83% of the population. The other 50 is only taking care of 17%. And healthcare is expensive. So just think that all the money that is being spent, 50% of the money that is being spent with respect to healthcare is spent in the private sector, and it's only taking care of 17% of the population. So that's the first thing to note. So that's really what's going to launch us into our study, because I feel like if we have been following the message and we are understanding equality and what it's all about, then we should already begin to see where this is leading. But as a baseline, I would like us to look at the golden rule. The golden rule will know what it is. You know, Elder Paminda has made reference to it so many times. Treating others as you would like others to treat you. I'm going to just share some statements from ancient cultures, because this is a universal rule and universal law that is, I think, inherently recognized by all societies. And I think all societies across the globe have tried to address this issue one way or the other. And there are different ways of saying it. If there's anything that that triggers you, or not trigger, but that jumps out at you, you're welcome to interrupt and make a comment. But I just was interested in how it can be phrased in so many different ways, and how those different ways actually add value to the golden rule and expand it, and really bring it to life. So the next statement is, do not treat others in ways that you would not like to be treated. It's a negative or prohibitive form. Then there is the what you wish upon others, you wish upon yourself. That comes from the root, the empathetic root, or a responsive form. Ancient Egypt put it this way: do to the doer to make him do. I really found this interesting, is that if you want to provoke a reaction from someone, you start by doing it to them yourself. Or the other way of looking at it, if you do something to someone and they return it to you, don't be surprised, because it's what you did to them. In ancient India, they put it like this: one should never do something to others that one would regard as an injury to one's own self. In brief, this is Dharma. Tamil is South Asia. They put it this way: why does one hurt others knowing what it is to be hurt? Ancient Greeks had multiple ways of putting it, but I just pulled out one. Avoid doing what you would blame others for doing. The Persians said, whatever is disagreeable to yourself, do not do unto others. The Romans said, treat your inferior as you would wish your superior to treat you. This is another interesting one. Obviously, the way I want my superior to treat me is as an equal, and therefore the call is for me to treat whoever I view as an inferior equally. And of course, in the Bible has made reference to this. In the Old Testament, in Leviticus, it says, you shall not take vengeance or bear a grudge against your kinfolk. Love your neighbor as yourself. I am the Lord. And I think this one, we even addressed it during the studies that Milton did a few months ago, weeks. In the New Testament, Christ himself said, do unto others as you would have them do unto you, on the Mount of Olives. So the golden rule is the baseline. It is just a basic rule or principle by which we are to live. And so going back to the picture that we've painted here, we all know that government, is there to make rules, to build policies, and to govern the country, manage the monies, the service deliveries, all that, taking care of people. But I promise you, you will be hard pressed to find a government official, not employee, but official, ministers, presidents, vice presidents, big people like that, who actually use the public sector for healthcare. When they get sick, where do you think they go? Do they go to the local clinic, or do they go to the local Netcare Mediclinic? So we are going to look at healthcare. Who is responsible for providing healthcare? How are governments doing this around the globe? I would like to hear from you. Let's just get away from the South African scenario for a bit and maybe go to other countries. Does anyone know how other countries are providing healthcare? How are they doing it?
When you look at most countries, especially in Africa, healthcare has been the department which it's consequently it's affected by bad governance and politics. So it's one of the broken systems or departments in most African countries. So most of them they rely on either private care, or some even dash out of their countries and go to international healthcare system where other countries have strong institutions. So most of them, it's not that they profess to build local institutions, but they in practice it's not there. And the reality is that they don't find safety in trusting them. the public sector in terms of health.
That is true. In fact, in most African countries, what you're saying, in most African countries, people rely upon themselves to see what they will do when they get sick. I just want to repeat what you're saying, but in other words. Like, for example, if you go to some countries in Africa, if you're sick and you go to a hospital, a public hospital, which is purporting to provide free care, you will actually not get help unless you pay someone money directly. So it's claimed that it's free, but in fact, you only get help when you pay someone. And it's always done under the table. I know for sure that in Zimbabwe it's like that. I know in Uganda it's like that. For example, you have doctors working in the public sector. They are employees in the public sector. They are being paid salaries. They see patients in the public sector, but they also have surgeries and practices, private practices. And if they see you, a patient in the public sector, they will tell you, they will refer you to their private clinic. They will tell you, here in government, nothing will be done for you, but I know where I can send you. I can refer you somewhere. And desperate people will resort to anything to get well. And so they refer these patients to their private practices where they charge them money, and then they get things done really pretty fast. And as Milton has mentioned, some people even have to leave the country to go somewhere. We know this is a very popular kind of, what do you call that? People visiting other countries. Tourism. It's called medical tourism, where people travel from country to country to get help. It is because their countries are failing to provide healthcare. When I was growing up, I didn't even know that it's the job of the government to provide healthcare. If you got sick, it was up to you. You'll see what to do, you know. And the healthcare and the care that you get depended very much on how much money you had in your pocket. Anyone else? Are there any other countries we could make reference to?
Yes, Doreen.
Yeah.
So I think when we look at it like across the globe and how the healthcare is handled in different countries, we see in some countries where like the government pays healthcare, you know, countries like I think it's Canada and the United Kingdom, where like the government is involved in direct providence for healthcare for all its citizens. And then we have, just like South Africa, obviously, we have a multi, some sort of a multi system in such a way that the government and also the private sector are involved in ensuring the healthcare for its people. And also, I think countries like Germany and France, they ensure the same system as ours. And then we see like countries like the United States, where it's dominantly your private hospital or private insurance, things like that, where they like pay you use your own money to pay for your health. So we across the globe we have those three scenarios in which the government in that country they implement. But I just also want to comment that you also see that even when it comes to the one of where you have both private and government paying out, you find out that the public hospital, you know, they are neglected. They don't have that quality healthcare that people need, you know. So even though it's there, you still find people paying for private healthcare because they don't get the quality that they're supposed to get when it goes to public hospitals. So I think it's the challenge that where we find the two in hand in different countries that we see that, you know. So the focus of the government, like I think it should be different when it comes to this, especially when you shown that how is it they providing 50-50 for something that's not even 50-50, that's not even equal, that the public supplies for 83% of the population, while the private supplies 17, but you give 50-50. It should be, they should actually get a system in which they it's equitable, you know. So yeah, uh, not to say anything further.
No, thank you. Thank you for your comments. Okay, so yeah, thank you for those examples. We've looked at the African situation. The African situation is messed up. And then we look at the countries like UK and Canada. Yes, they provide universal healthcare. What that means is that in UK and Canada, the government provides a medical aid for everyone, regardless of whether you are employed or unemployed, regardless of your income. Okay, it may not be that simple, né? But overall, in very simple terms, that's how it works. The government provides the insurance, the funding. So if you get sick, you go to a clinic or a doctor or a hospital, the government will pay the bill in UK and Canada. In the United States, they have a system that is predominantly you fund yourself. You know, you find your own medical aid. Mostly it's employers that will provide medical aid for their employees. And then the marginalized populations, especially the Blacks, because they fall under that category, they get cared of by a little bit of a contribution from the government. But by and large, the United States is spending the most money in healthcare, and it's very, very, very expensive, and the government does not really provide much cover for people. Mostly people have to cover themselves. And in South Africa, we have the picture that we've just shown. So just to demonstrate how this plays out, let's say I'm in an accident and I fracture a bone and I need an operation. If I have medical aid, I may get that operation within 20 to 48 hours, almost immediately. You know, the ambulance will come pick me up, take me to Mediclinic, and I have all these private specialists taking care of me, and I'll get that operation done as ASAP, as soon as possible. And this reduces the chances of complications, and of course, I'm in a comfortable zone, and I get the top care that I can get in South Africa. And of course, it depends also on what type of medical aid you have. and what kind of benefits, what kind of package you have, because it's also not the same. There's a lot of inequalities, because, like, for example, if you are in GEMS, a member of GEMS, and you're an Emerald package will say will cover you for everything. And then maybe if you're on Beryl, they'll say, we will only cover you for this number of GP consultations, and we will only cover up to this amount for hospitalization. I think we are familiar with the South African system. We know how it works. Even within the medical aid system, there is inequalities. It depends how much you're contributing. That determines how much you benefit. Yeah. But if I don't have a medical aid and I've got this fracture and I am in Johannesburg, or I live in Johannesburg, or I live in Cape Town, then I'll be taken to the nearest CHC or clinic. And then if it's severe, of course, I'll be transferred to the nearest regional or provincial hospital for the operation. And then, depending on the backlog, I may get that operation done maybe within, 2 weeks or a month, or maybe, whatever period of time the government is able to provide. But if I am in the rural areas, let's say I'm in a village somewhere in Limpopo or Eastern Cape or KZN, it may take even a bit longer. It may take 2-3 months maybe before I get my procedures. And of course, the longer it takes for doctors to intervene in a case like that, the more likely complications may develop. And, these kinds of complications become very costly down the line, not only to the individual, but to the family, to the community, and to the state. And the scenario that I'm painting is very, very common in South Africa, where we're seeing, because, the incidence of accidents in South Africa is very, very high. And we see lots of trauma, lots of broken bones. And this is a very, very common problem. It happens quite frequently, where people have sustained serious fractures in accidents, but because if they are covered by medical aids, they will get instant care. But if they are in the government sector, there'll be delays, not just even in stabilizing the emergency situation, but even in the definitive care that needs to be instituted. If they need operations, that takes long, it takes time, and they tend to develop complications. Now they can't go back to work if they were employed. Maybe they even become disabled, and eventually they are going to have to depend on the state for a disability grant. So you see that the inequalities are really quite massive in South Africa. Another scenario I can paint is, a woman is pregnant and she develops complications and she needs a cesarean section. Maybe how I should put it, she develops complications. In private care, you almost get instant assessments and definitive managements getting done. And most of the time they will do cesarean sections. Cesarean sections are very safe. They're a very good way of avoiding complications both in the mother and in the baby. So you see that the rate of cesarean sections is very, very high in the private sector. They are trying to avoid problems, especially with the babies coming out, later on developing things like mental retardation and developmental problems. In the public sector, because of the volumes, the public sector has to take care of these 83% of the population. So the volumes are huge. in the public sector, there may be delays, and that's why we end up with a higher complication rate among mothers and the babies. The maternal mortality rate is higher in the public sector than in the private sector, just because 50% of the money has to take care of 83% of the population. So you can imagine how difficult a job is for the public sector. The responsibility that they are having with the resources that they have, limited resources that they have. So there's always delays in providing the services that are required. And so people tend to suffer more in the public sector than in the private sector. Yes, Tando, you've raised a hand.
Hey, Elder Team, tell me, why is the money divided 50-50%? I'm just trying to think deep about it. Why might be the case why the private sector is getting 50% where else is helping a little of people, and 50% goes to the public, where else they're the ones who are mostly involved in helping the community in large? Or is it this because of the system that has been put in place from maybe apartheid time, and it also just evolved and then went along that direction?
Thank you for that question. Very important question. To clarify how this money comes about and how it's calculated and how it's divided. Of course, we're going to look at the history of how things developed in South Africa, going all the way back to the 1900s. But actually, when they calculate the GDP, they calculate all the goods and services. I don't know exactly how it's done, but they calculate all the goods and services and come up with this figure. And then when they look at the healthcare, it's not like there is a lump sum that the government gets maybe from the treasury, and then they take this lump sum and divide it into half and say 50% will be for the public sector and 50% will be for the public. That's not how it's done. The government has its money, okay? Every year that they have to announce the budget, and they tell us how much money there is. They begin to allocate the monies to the different ministries. You know how that works. The money comes from the Reserve Bank, whatever, and the taxes and all of that. So the government has its money that it has in its bank account, if I can put it simple like that. But just like you would sit down in your own home, when your salary comes in, you have a lump sum. Then you will decide, this is for rent, this is for groceries, this is for school fees. You will divide your income according to your need. So the government does that. They have this lump sum, then they begin to split it up. This is for education, this is for health, this is for the military, this is for what. So that amount that is allocated to health, all that money is used in government because it's government money. It's used in the public sector. Whatever is allocated to the Ministry of Health, it will be used for health system, for the health system. It will pay salaries, it will build hospitals, it will provide drugs, it will provide equipment, whatever is needed in all the provinces. Yeah. Now, the private sector is completely private. It does its own thing. It raises its own money. It does its own budgeting, whatever. Because in the private sector, what we have is medical aid schemes, right? These medical aid schemes have members, and the members contribute money on a monthly basis. So they pool money And then you will see, like, for example, Discovery, it has its members. The members will be making contributions every month, every month, every month. And when one of those members needs to claim, they will take from that pool of money and pay the service provider. So all of that money, when you calculate it, né, and you put it all together, all the medical aids that are contributing, not only that, even the money that you pay privately from your own pocket, I mean, when you get sick, when people get sick and go visit the doctor, the private GP, or the private hospital, and they pay in cash, because some people can be able to pay, let's say, a family, the mother is pregnant, she doesn't want to go to the government hospital, she wants to go to the private hospital, and the cesarean section is going to cost 60,000, and the family can afford the 60,000, they will take it out of their pocket and pay the hospital and the doctor and the fees and everything. So all of that money which you pay privately when you go to a private doctor or a private hospital, plus all the money that members of medical schemes are contributing, when you add that all that money together, it's equal to how much money the government puts aside for government public services. Because remember, it's about 50-50. So there's a huge amount of money that people are spending in the private sector for themselves from their own pockets or by contributing towards the medical aid schemes. But those people are only 17% of the population. So the other 83% of the population has to depend on what the government can afford. So that is why you see that there's a very big disparity between the public and the private sector. If, for example, I am a parent, I'm the government, and my salary is 5,000, and I have 5 children, and they are all going to school, and I need to pay maybe 600 Rand for each child. Compare me to another parent, maybe Tato. You are earning 5,000, but you only have 1 child, and you just need to spend that 600. Sorry, no, you have that 1 child, but you have that 5,000. You can spend your whole 5,000 on that 1 child. But myself, I have this 5,000 Rand and have these 5 children and have to spend that 5,000 for those children. I don't know if I'm making it clear. So that's the difference between the public and the private. It's not like there's a lump sum that gets divided and some is given to private and some is given to public. No, it's about how much me as a parent of 5 children I have. So me, I'm the government. I have to take care of 83% of the public, and I have, let's say, this 8% of the GDP. What's the 8% of the GDP? Let's try to calculate it. This 405 billion US dollars is the total GDP. So 8% of it is how much? Sorry, times 8%. Yeah, so it's 32 billion Rand. This 32 billion Rand is what the state, the government is spending, the entire country is spending on health. Now that 32 billion is divided 50-50 between public and private, which means around 16 billion Rand is what the government can afford. Me, the government, I have 83%. I have 83% of the population. I have 16 billion Rand that I must use. whereas Tato has 16 billion, but he only has 17 children to take care of. So obviously, Tato will end up literally spoiling his children because he has so much more money and he has fewer children. He can give them all the nice goodies in healthcare as he wants because he has access to all this money. Whereas myself, my money is limited. I have so many children. I have to now try and divide it, who gets what, where, who has which problem. How can I allocate this money so that at least I try to cover everyone? And remember that these 83 children that I have, some are not sick, some are very seriously sick, some need operations after operations after operations, some need medication every month, which is, expensive. So for example, we have so many people on ARVs, and ARVs are very, very expensive. If you have to pay for ARVs out of your pocket every month, you'll be spending around 500 to 600 Rand every month. Now the government has to pay that money to provide those drugs for all the children that it has. And that is why the inequalities are so bad that people are starting to think, and this system is not sustainable. We can't continue like this. In the private sector, they will tell you, but this is our money. We want to do with it what we want. It's not coming directly from the government. But remember again that somehow it's linked to the government. So for example, if you are a member of GEMS, you are a government employee, the government is paying your salary and the government is also paying for your medical aid. So, but when you get sick, you don't go to government, you go to the public sector. Sorry, the private sector for your health. So it's again, on top of the government having a budget for health, it has to fund its own members to go to private sector. I've partially answered the question, I hope, Tato.
Yes, you have. Very clear. Thank you so much. It's quite it's very complex.
Yeah, it's complex, but I think bottom line is we are beginning to see the inequalities. I hope. Okay, final generation. I don't know who's that. You raised a hand.
Okay, I just wanted to add, when you look at the compression of data when it comes to the budget now after the year has ended, the GDP is put together. In principle, when you look at that money, which is put 50-50, and you look at the actual contribution which both sectors have made, public and the private, you might find arguments from the private sector that they are still even doing government a favor. They don't even want them to get that 50 because government is not, it's so outperformed. The public sector is not making profit and it's a broken system. So even that 50%, if the government does not come with a law that protects the principle of equality, they might not even win that argument that they need to shape it. They don't even look at the percentage who is benefiting or not. They look at the contribution. And in principle, they have to sort out that through implementing a law. Otherwise, the argument on paper, it's not something they can win.
Yes, that is true. And that is why I actually made a distinction between public sector service delivery in urban areas compared to service delivery in rural areas. There is still inequalities even within the public sector. Most specialists are in urban areas. So urban patients tend to get quicker, more definitive care than in the rural areas. I work in the rural areas. If I see a patient that needs an operation, we have to refer the patient to Polokwane. Polokwane is 3 hours away. So all of that means transporting the patients back and forth, back and forth, back and forth at state expense, and the time and the burden that it bears. Whereas a patient in an urban area who lives in Polokwane or who lives in Johannesburg, they get quicker care. The systems are more efficient in the urban areas. So even that 16 billion rand that is being spent in the public sector is not evenly distributed. People in rural areas tend to suffer more. And there've been instances where we get stuck and we tell the patient, you know what? If you have relatives in Joburg, I think you better go to Joburg because you will get quicker care there. I mean, the South African government, compared to other African countries, I think is providing the best healthcare. But we are still looking at a system that's broken and a system that really needs to be reformed because it cannot continue in this way. If we are going to follow the golden rule, what you wish upon yourself, you need to wish it on others. That is why you're you'll be hard pressed to find a government official that goes to public sector when they're sick. So they sit in these government offices and control the money and determine where it goes. But they are not trying to provide for the people what they would wish for themselves. Or even people in the private sector, doctors in the private sector, they make a lot of money compared to doctors in the public sector. Because as you can see, the public sector budget is limited. The public sector can only afford to pay nurses and doctors and other healthcare workers a certain amount. When you go into the private sector, that can be tripled or 10 times multiplied. So the potential is limitless. It really depends on how good you are or how much you want to work in terms of how much you can earn in the private sector. You can earn a lot. And those very doctors, some of those health workers and people in the private sector are the ones really fighting against the NHI. And then you wonder, where is the golden rule? Because if they want to get sick themselves, they'll never come anywhere near a public facility. But anyway, that is just from the golden rule perspective of trying to treat people equally. But let's go to more formalized forms of this mandate that government has, because we can ask the question, whose responsibility is it to provide healthcare? If I am sick, whose responsibility is it? Is it my responsibility? Is it the responsibility of the state? So let's look at some laws. The ANC has a freedom charter on health. It has a freedom charter on just a global freedom charter. And in that charter, they have a statement on health where they say that a preventative health scheme shall be run by the state. Free medical care and hospitalization shall be provided for all, with special care for mothers and young children. So this is the ANC mandate to itself. It's the statement they made however long ago they made it, the promise that they have made that as a party, a political party, if they are in government, this is what they are going to do. They're going to provide a preventative health scheme. Now, I just want to go into this and ask a question that I think everyone can answer. What forms of healthcare are they? We've looked at the funding aspect of it. Now I want us to look at the actual practice of it. Is it better to prevent a disease or to treat a disease? Is it cheaper to prevent or to treat?
To prevent.
To prevent. Is there anyone with a different perspective? I think it's pretty straightforward. It's easier, it's cheaper, it's more convenient to prevent disease than to treat. Because once a disease has developed, the steps that have to be taken to reverse it are very expensive. You're talking about drugs, you're talking about blood tests, you're talking about x-rays, CT scans, you're talking about taking biopsies, you're talking about operations, expensive. Whereas prevention is all about health promotion, health education, and public health, just providing people with information so that they can make healthy decisions and about their health, what to eat, how to take care of their bodies, providing healthy options, accessible to people, taking care of the public and making sure that dangerous substances or foods are not easily accessible. That is the responsibility of the government. If they can, if they're focusing on preventative healthcare, that is what it's about. It's about having more clinics, more health centers, clinics providing family planning services, sex education, education about non-communicable diseases, screening programs, screening for cervical cancer, screening for TB, screening for hypertension, diabetes. And these services have to be distributed right there in the communities and be accessible. So someone doesn't have to jump into a taxi to access the nearest health facility. They should be able to walk to it. And when they walk there, they don't have to pay any money. They can be educated. They can be given all the education that they need and all the preventative and screenings that they need without having to pay any money. So this is the emphasis of a preventative health system. Contrary to that is the curative health system. When you compare and contrast the two, preventative and curative. Curative is all about the patients have the disease and now you have to manage it. And that is more what I've already talked about, the tests, the investigations, the medications, the operations, all of that, even hospitalizations. That's a health system that focuses more on building hospitals because they are not tapping, they're not closing the tap, so they have to wait for the overflow and deal with it at that level. And at that level is much more expensive. Preventative healthcare is about training more nurses and primary healthcare doctors like GPs and family physicians. The hospital kind of system, curative system, requires more specialists. And you know, specialists are paid more, hospitals cost more to build and all of that. So I want us to see that distinction as well as we continue with this study. At the end of the day, to prevent disease is much cheaper and is easier and it's less costly even to the state itself than to actually cure the disease. And so when ANC was developing as a political party and it wanted to have a position on health its emphasis was going to be on preventative health care, rather than the hospital kind of scenario. So in 1994, when the first government of national unity came into position, they started working on a new constitution. In the constitution, under the Bill of Rights, there is a statement on health. And this is the statement. It says, healthcare, food, water, and social security. Number one, everyone has the right to have access to healthcare services, including reproductive healthcare. Now, reproductive healthcare, this is abortion. It falls under this category. So that's the government's, the constitutional position on healthcare, that it has to be accessible to everyone. And when you talk about accessibility, it's not just in terms of distance, it's also in terms of cost and money. So under the Constitution, it's everyone's right, when they fall sick, they should have a clinic nearby that is affordable. Either it's free or the cost is so little that even the poorest person can afford to go there and get a service which is equal, whether the person is a billionaire or is on a disability grant unemployed. They should have access to healthcare services. And these healthcare services should be equal, because where is the sense that somebody who is unemployed and is not on a grant cannot get an operation that they need because they are in the situation that they're in? How fair is it that the next person who's a billionaire, because they have money, they can get anything in healthcare that they need at any time, almost instantaneously, on demand, when they need it? Where is the fairness in that? I mean, we can sit and say, okay, healthcare should be accessed based on one's income. So it means if I am earning, I can afford good healthcare, but somebody who's not earning is not having a right to good healthcare. So this kind of inequality is very detrimental. And some governments around the world are trying to address it. And I think Canada and UK have done a good job in trying to address that inequality, to say that it doesn't matter who you are. It doesn't matter what your race is, your color, your gender, your income. Everybody needs to have access to the exactly same quality of care. So this is in the Bill of Rights. It's every South African's right to have access to good healthcare. Not that it's right next to them, but also that they can afford it. Yeah. So I think I'm going to wind up now. We'll continue in the afternoon. So how to achieve universal healthcare? There is what they call the universal health coverage. This is let me see. This is a directive from the United Nations to all member countries. You know, the United Nations group of countries was what? What's the word? The United Nations was It started in 1945 after the First World War. Nations coming together to work towards a common good for humanity. And they have tried to come up with different strategies to achieve equality across the globe over the years. The latest one is called the Sustainable Development Goals. And one of those sustainable development, the SDGs, I think they are the goal list. They have a position on almost every aspect of life. There are 17 goals, and included in these goals is alleviating poverty, ensuring good quality education, gender equality, clean water and sanitation, just addressing basics. These mandates, every country has to sign that they agree to go back to their countries and implement these mandates. Ne? So, for example, alleviating poverty. Every member country agrees and they sign and say, we will go back to our country and alleviate poverty. And then the UN monitors these things. They monitor, is South Africa overcoming poverty? Are they implementing the strategies that we have developed? So on health, it says good health and well-being is one of the 17 sustainable development goals established by the United Nations in 2015. So South Africa is a member of the UN. It means that it has signed and agreed that it will ensure that a good health and well-being for its citizens. So how this is being done, the UN has a universal healthcare coverage statement. It says universal healthcare coverage means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. It covers the full continuum of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care. So if any country is a member of the UN and they have signed the mandate and they've agreed that they're going to do this thing, it means that they are under obligation to make sure that every citizen or permanent resident or anybody that is legally in the country, that they have access to quality healthcare when they need it, where they need it, without financial hardship. So it means that anyone, whether they are poor or rich, male or female, whatever gender, whatever nationality, whatever race they are, they must have access to a universal healthcare coverage system. And that system is supposed to, number one, start by promoting health and preventing disease. That is a primary objective. Then should disease develop, they are supposed to treat it. And should disease result in complications and disability, they're supposed to provide rehabilitation. And if the disease is not curable and it's terminal, the country has to provide palliative care. Palliative means it's the care that is given to people who are dying. So this is the UN directive. And South Africa is a member of the UN, so it has agreed that it will provide this healthcare. So now the ANC comes and says, okay, how we are going to do this thing? We're going to provide a preventative health scheme that shall be run by the state, providing free medical care and hospitalization shall be provided for all, with special care for mothers and young children. We know ANC has been in leadership since 1994. This is 30 years now. 1994 to 2024 is 30 years. And we're going to look at something very interesting about these 30 years. And I want us to go away thinking about it. In 1994 was the first government of national unity, established in 1994. Now in 2024, we are having another government of national unity being established. And the gap between is a history of 30 years. The 30 years in which the government has been under obligation, not just from the UN, but from its own charter, the ANC, to provide a universal healthcare that is accessible to all. It's good quality, emphasizes health promotion and prevention, but also provides hospitalization treatments, palliative rehabilitation, and palliation. When we come back, we are going to go into the history of the developments in South Africa. But there are two ways in which a universal healthcare system can be provided. It's either through a social health insurance, where only those who contribute are entitled to benefits. Social health insurance. Contributors may be all employed people or defined groups in certain industries or all taxpayers. That's one way in which universal healthcare can be provided. The other one is through a national health insurance. Usually the same taxpayers are making the contributions, but everyone is entitled to benefits. Yeah, so we're gonna close with that and then we will come back in the afternoon. I don't know if anyone has a last comment or question they want to ask.
I just wanted to give another example of how far we can actually see that the issue of healthcare in the majority of countries have been a failure. Like when you look at countries like UK and Canada, which were good examples, beyond just the healthcare, we have seen that they are able to reserve funds even for the elderly. When you look at countries like UK, kids or children, they don't have the obligation to think about the future of their parents when they're old. The government takes care of that. But when you come to Africa, it's a different dynamic. I remember recently we were having some sessions on counseling, and some people are asking, is it a right? Are we supposed to look after our parents or not? And you cannot run away from the fact that given the current institutions we have from governance perspective, even if you have the right not to, you might find that you don't have a choice because of the circumstances. So it's the same principle that universal healthcare is trying to address, the issues that can liberate our society from some of the things which are consequences which we cannot run out.
Thank you. Any other comment? So equality affects every aspect of life. I know we are dealing with gender mostly by and large, but race is still an issue. Nationalism is still an issue. And, you cannot talk about equality in the broader aspect and on the broader level without discussing health. Health is fundamental to a human being. We know the body is the house in which we live, and the body is not us, but we live in it, and we are affected if the body is affected. If I am sick, if I am tired, if I'm stressed, I will not be able to make good decisions for myself. I will compromise myself. So healthcare is integral to equality. We have to discuss health. In the past dispensations, we focused so much on individual health. It was all about the health laws, teaching each other, at the camps, trying to teach each other how to cook, what herbs to use. The emphasis was on individual health and how I can take care of myself and how I can share some information with the next person so that they can also, go home and do their thing. And that is good. We still live by those principles. But I think on top of that, we need to just look at just healthcare broadly in terms of service provision. Whose responsibility is it of taking care of vulnerable people when it comes to their health needs? What are governments doing? And we are in 2024, we are facing the Sunday Law. What governments are coming into leadership? And what are they going to do when we're talking about healthcare? Just before elections, the president signed the NHI into law, and it's very, very interesting that it coincided just with the elections. But I think that was a very strategic move, because if he didn't do that, we were going to, But anyway, let me not go ahead of myself. We will talk about that in the second part of our study. I just want to read, someone made a comment. Where are the charts? Yeah, here we go. Let me read the charts before we... Oh, the first was the question that Tato asked. And then Zoe had the same question. Thanks so much for this lesson and engagement from others. The stats information, thank you. Okay, thank you, Rasedi. All right, let's go. Let's have a break. We'll come back in the afternoon and try to see if we can get through the material. We'll look at the history, how things developed in South Africa and where they are now. Yeah, so let's close in prayer. Dear Lord, we want to thank you for leading us through this hour as we are looking at external aspects of healthcare and equality and how so many vulnerable people around the world are denied healthcare just because the systems are not set up right, and because of selfishness, because of people continuing to deny the golden rule, because of sin and where it has led us, because of the curses of inequality, gender, and racial. And these are the curses that, Lord, you are seeking to educate us about as you're working to lead us back to Eden, giving us a broader view of how things have developed and what needs to happen, and which side of the equations we need to be. So I pray, Lord, that you'll continue to educate us and continue to make us receptive. In Christ's name we pray. Amen.